KEA Tutorials presents Talipes Equinovarus. Definition. Clubfoot or congenital talipes equinovarus describes a range of foot abnormalities usually present at birth. In this condition, your baby's foot is twisted out of shape or position. In clubfoot, the tissues connecting the muscles to the bone tendons are shorter than usual. Now let's dive into the various symptoms of clubfoot. The first type is cavus, a foot deformity in which the arch of the foot is high and often the heel adducted. The second, adductus, in which the forefoot turns toward the midline. The foot may be supinated at rest. Usually, the foot can be passively abducted and everted beyond the neutral position when the sole is stimulated. The third is termed varus, in which the heel of the foot is turned inward, so that the arch is raised. This deformity usually results from in utero positioning. It typically does not resolve after birth and may require corrective casting. And lastly, the equinus, in which the foot is pointed downward, forcing one to walk on tiptoe. This motion occurs naturally, but in clubfoot the foot is fixed in this position. Now let's dive right into the risk factors of this condition. This condition's exact cause is unknown, but some factors have been associated with the development of this condition. The first factor, environmental. The second factor, genetics. If one identical twin is affected, there's a 33% chance the other one will be as well. Mutation in genes involved in muscle development are risk factors for clubfoot. The third factor, reduced amniotic fluid, which can also vulnerize a child to this condition. The fourth factor, smoking. This can lead to fetal malformations including clubfoot. And lastly, alcoholism, which can impair the baby's developmental process. Let's see how to diagnose this condition. The diagnosis involves both physical examination and imaging tests, such as X-ray. Let's discuss the treatment of clubfoot. The first method is called Ponseti method. It includes serial casting, Achilles tendon release, and bracing. The foot is manipulated and casted 4 to 6 times to correct the deformity. The goal of the first cast is to align the forefoot with the hindfoot, because it appears pronated as compared to the hind foot, so supinating and elevating the first metatarsal improves alignment. In subsequent sessions, abduction of the forefoot is increased and the hind foot is moved from varus to valgus. And lastly, the final casting is to correct the equimus. Also called Achilles tenotomy, is a surgical procedure by which the Achilles tendon is surgically corrected to solve the equinus symptom of this condition. It's usually done after serial casting. And lastly, bracing. Done after serial casting, and Achilles tendon release, to prevent the foot from returning back to the deformed position, over the first few years of that child's life. The French method is more conservative, non-operative. It involves physical therapy for the first 2 months, followed by 4 months of therapy at a rate of 3 times a week. Home exercises, to strengthen the muscles, and splinting to help in immobilization. Obviously, surgery is also an option. Surgical procedures which can be done include Achilles tendon release and posteromedial release. Thanks for watching. Don't forget to subscribe and smash the notification icon so that YouTube keeps you updated of our activities. See you in another video.